I want you to do something for me right now. Look down at your feet, just for a moment. Look at them. Because what I'm about to share with you today could be one of the most important things you hear this year. Not because I want to frighten you, but because there is something happening inside millions of people's bodies right now, quietly, without pain, without any obvious warning. And the only early clues are showing up in their feet. Most people miss them completely. They see something, they feel something, and they say to themselves, "I'm just getting older." And they move on, and the disease moves with them, deeper, further, doing more damage with every passing month. I've been practicing medicine for nearly 3 decades. I've sat across from thousands of patients in my office, and one of the things that keeps me up at night is how many people came to me too late. Not because they didn't care about their health, they cared deeply, but because nobody had ever sat down with them and said, clearly, plainly, here is what your body is trying to tell you. Here's what to watch for. My name is Dr. Caldwell, and that's exactly what I'm going to do today. We're going to talk about 9 warning signs in your feet that can be early signals of diabetes, a disease that currently affects over 37 million Americans, with millions more who don't even know they have it yet. Some of these signs will surprise you. One in particular, I want you to stay for, because it's the one that catches even careful, health-conscious people completely off guard. So please don't go anywhere. Every one of these matters. I want to tell you about a patient of mine. I'll call him Harold. Harold was 67 years old, retired school teacher, sharp, active, took good care of himself. He came to see me for a routine checkup, blood pressure, cholesterol, the usual. But when I asked him to take off his shoes and socks, which I always do, I noticed something. The skin on the bottom of his right foot was cracked and thickened. The color was slightly off, and when I pressed gently on his heel, he barely reacted. "Does this hurt?" I asked him. He looked almost confused. "Not really," he said. "Should it?" That's when I knew. We ran the tests. Harold had type 2 diabetes, had likely had it for 2 or 3 years. And in that time, the nerve damage had already quietly begun. He couldn't feel pain in his feet the way a healthy person should. When I told him, he was stunned, because he had noticed things. A tingling feeling at night, some changes in his skin. He just hadn't thought much of it. "I figured it was age," he told me. "Harold is doing well today. We caught it, managed it, and he's taking wonderful care of himself." But I think about how different his story could have been if no one had ever told him what to look for. I'm telling you today, the first sign is numbness or tingling in the feet, especially at night. Most people who feel this write it off immediately. They think, I sat too long, I crossed my legs, my foot fell asleep, and sometimes, yes, that's all it is. We've all experienced that. But here's the difference. When the tingling happens regularly, when it wakes you up at night, when it's there in the morning, when it comes and goes without any clear reason, that is not just circulation. That is your nerves sending a distress signal. Think of your nervous system like the electrical wiring in your home. When everything is working properly, signals travel cleanly from your feet to your brain and back. But high blood sugar, the kind you get with uncontrolled or undiagnosed diabetes, is like water slowly leaking into that wiring. It doesn't blow a fuse all at once. It just causes the signals to get weaker, more distorted, over months and years, until parts of the circuit stop working properly. This is what doctors call peripheral neuropathy, and it affects somewhere between 60 and 70% of people with diabetes at some point in their lives, according to research published in the journal Diabetes Care. What's important to understand is that the tingling is actually the early warning. Numbness, real numbness, is what comes next if it's ignored. So if you're feeling that sensation in your feet regularly, without an obvious reason, please write it down. Mention it to your doctor. Ask for a fasting blood sugar test. Don't wait. The second sign is feet that stay cold, even when the rest of your body is warm. Most people just reach for thicker socks. And sometimes cold feet are simply cold feet. Poor circulation from sitting. The season, getting older. But here is what most people don't realize. When diabetes begins to affect the small blood vessels in your body, the first place it often shows up is in the extremities. the tips of your fingers, and your feet. Think of your circulation like a garden hose that reaches all the way to the end of a long yard. If the hose is pinched or narrowed somewhere in the middle, the water still comes out at the end, but it's weaker. Less pressure, less volume. That's what's happening in the tiny blood vessels of your feet when diabetes begins to damage them. The blood arrives, but not enough of it. Not consistently, and so your feet stay cold. A study from the American Diabetes Association found that reduced blood flow to the lower extremities is one of the earliest measurable signs of diabetic vascular disease, and it often appears years before a formal diagnosis is ever made. Cold feet alone don't mean diabetes, but cold feet combined with other signs on this list? That combination matters. Don't normalize it. Pay attention. The third sign is one of the most serious, and I need you to hear this carefully. Slow healing cuts, sores, or blisters on your feet. For most healthy adults, a minor cut heals in a few days. A small blister closes up within a week, but for someone with elevated blood sugar or diabetes that hasn't been caught yet, healing slows down dramatically. I've had patients come in with a small sore on the bottom of their foot that had been there for 3 weeks, 4 weeks, 6 weeks, still open, still not healing, and almost every time they say the same thing. It's just a little sore. I figured it would go away. Here is why it doesn't. High blood sugar does 2 things that make healing nearly impossible. First, it impairs the white blood cells, your body's soldiers against infection. When those cells can't function properly, even a tiny break in the skin becomes a doorway for bacteria. Second, it narrows those small blood vessels, so the nutrients and oxygen your skin needs to repair itself can't reach the wound effectively. Think of it like trying to rebuild a house with no supplies being delivered. The workers are there, your cells are trying, but nothing is arriving to actually do the job. Diabetic foot ulcers are one of the most serious complications of this disease. Research shows they are the leading cause of non-traumatic lower limb amputations in adults. Not from accidents, not from injuries, from an unhealed sore on the foot that was ignored for too long. If you have a cut or sore on your foot that is not healing within 2 weeks, please see a doctor immediately. And in your daily life, check your feet every single day. Take off your socks. Look at the bottoms, between the toes, around the heels. Use a mirror if you need to. This takes 60 seconds. It can save your foot. It can save your life. I want to ask you something right now. In the comments below, just type the word feet if you've ever had a sore or blister that took longer than usual to heal. Just that one word. It helps me know what you're experiencing, and it helps this information reach others who need it. The fourth sign is one most people have never connected to diabetes at all. Dark, velvety patches of skin on your ankles, on your feet, or perhaps on the back of your neck, your armpits, or the inside of your elbows. If you've noticed this kind of darkening, skin that looks thickened, almost velvet-like, I need you to pay close attention right now. This condition is called acanthosis nigricans, and it is one of the most reliable early visual signals that your body is struggling with insulin resistance, which is the direct precursor to type 2 diabetes. Here's a simple way to understand what's happening. When your body becomes resistant to insulin, when your cells stop responding properly to the hormone that processes sugar, your pancreas tries to compensate. It makes more and more insulin. And all that extra insulin in your bloodstream has an unusual side effect. It stimulates skin cells to multiply too quickly. They pile up in dark, velvety patches. It is like a traffic jam. The car at the front isn't moving, so the cars behind keep stacking up. The overflow has to go somewhere, and it shows up on your skin. A study published in the Archives of Dermatology found that these skin patches correctly predicted insulin resistance in the vast majority of cases, even before a blood test showed anything abnormal. So if you see this on your body, show it to your doctor. It is not just a skin issue. It is a message from inside your body. Listen to it. The fifth sign is so quiet that most people never notice it at all. Loss of hair on the feet and lower legs. Look at your legs right now. Arsopo, or think about them. Is the hair on your lower legs thinner than it used to be? Are the tops of your toes smooth and bare? Most people say, I'm getting older. Hair thins everywhere. And that's true. Some thinning is normal. But here's what's different. When the blood supply to your lower extremities is chronically reduced, as happens with diabetic vascular disease, the hair follicles on your legs and feet are among the first to stop getting adequate nourishment. And when follicles don't get enough blood supply, they stop producing hair. Gradually, quietly, without any pain, think of it like a lawn that isn't getting enough water. The grass doesn't die overnight. It just slowly thins, patches appear. The fullness disappears without any single dramatic event to signal that something is wrong. A report from the American Heart Association found that people with diabetes are 2 to 4 times more likely to develop peripheral arterial disease, reduced blood flow to the limbs, than people without diabetes. And hair loss on the lower legs is one of its earliest visible signs. If your lower legs look noticeably bare compared to the upper legs, mention it at your next appointment. It seems small. It is not. If this video is helping you understand things you've never heard explained this clearly before, a thumbs up means a great deal to me. It tells me you want more of this kind of honest, straightforward information, and I will keep bringing it to you. The sixth sign is one that nearly everyone over 60 has experienced, and nearly everyone dismisses. Swelling in the feet and ankles. You've been on your feet all day. You've traveled. You've sat for a long time. And in the evening, your ankles are puffy, your socks have left a mark. It happens. It's common. But here's what most people don't realize about swelling and diabetes. When the kidneys come under stress, which happens gradually with poorly controlled blood sugar, they begin losing their ability to regulate fluid properly. The kidneys are supposed to filter your blood, manage water balance, and remove waste. When diabetes begins to quietly damage them, fluid starts to build up where it shouldn't, in the feet, the ankles, the lower legs. And the dangerous thing about this kind of swelling is that it often doesn't hurt. It's not dramatic. You press your finger into the swollen area, you see a small indent remain for a few seconds, and then you just put your shoe back on and forget it. But that fluid is telling a story. Think of it like the drainage system in your neighborhood. When the drains are clean and working, water flows away after a rainstorm. But if they're blocked or damaged, water pools. It sits, and the longer it sits, the more damage it causes. The National Kidney Foundation reports that diabetic kidney disease affects approximately 40% of people with diabetes, and it often progresses silently for years before any symptoms appear. Persistent swelling in the feet and ankles, swelling that doesn't go away after a night of rest that keeps coming back, is worth investigating. Don't just buy wider shoes. Ask why it's happening. The seventh sign is the one that people feel most dramatically and suffer with most silently: burning or painful feet, especially at night. People describe it in so many different ways. Like my feet are on fire, like I'm walking on hot sand, like someone is pressing a hot iron against the bottom of my feet, and it comes at night, when you're trying to sleep, when there's nothing to distract you from it. Almost everyone I've spoken to about this has said the same thing. I thought it was just circulation. I thought I'd overdone it that day. But here's what is really happening. Remember the electrical wiring analogy? When nerve damage progresses, the damaged nerves don't just go quiet. They can actually misfire. They can send false signals. Signals that say heat or pain when there is nothing there causing either. It's like a car alarm that goes off when no one has touched the car. The system is malfunctioning. It's sending signals that don't correspond to any real event. This is diabetic peripheral neuropathy in its painful phase. And it is one of the most common and most underreported complications of diabetes. Underreported because people feel embarrassed. They don't want to seem dramatic. They're not sure their doctor will take it seriously. I am telling you, this is serious. A landmark study published in the New England Journal of Medicine found that aggressive blood sugar control can significantly slow the progression of nerve damage, but only when it's caught early enough. Early enough. Those two words carry everything. If your feet burn at night, please don't suffer in silence. Tell your doctor exactly what you're experiencing, and if you've been dismissed before, say it again. Ask specifically, could this be nerve damage related to blood sugar? You deserve a real answer. I want to tell you about another patient of mine. I'll call her Dorothy. She was 72 years old, A former librarian, she had walked 3 miles every single morning for decades. She was proud of her health, and she had every right to be. Dorothy started waking up at 2 and 3 in the morning with her feet burning so badly that she'd get up and walk on the cool tile floor just to find any relief. She dealt with this for 8 months. 8 months. She didn't want to bother anyone. She thought she was being dramatic. Her daughter finally convinced her to come in. Dorothy had type 2 diabetes, had had it, we estimated, for at least 4 years. When I told her, she cried, not because of the diagnosis. She cried and said, "I lost 8 months of sleep, 8 months of suffering, and I didn't have to." She was right. She didn't have to, and neither do you. The 8th sign is one that most people treat as a minor annoyance and never once connect to their blood sugar. Fungal infections that keep coming back. Athlete's foot. Nail fungus. That yellowed, thickened toenail that just won't clear up no matter what you try. Most people buy antifungal cream, use it for a week or two, and move on. But here is what most people don't realize. Fungus loves sugar. Literally. When your blood sugar is elevated, especially over long periods, your skin, your sweat, and the tissue of your nails all contain a higher concentration of glucose. And glucose is food for fungus. It thrives in that environment. It grows faster. It holds on longer. It comes back even when you've treated it. Think of leaving a bowl of ripe fruit out in a warm, humid room. It goes bad much faster than it would in a cool, dry place. The conditions are just right for mold to take hold. High blood sugar creates those same ideal conditions for fungal organisms, on your skin, on your nails, between your toes. There's another layer to this. High blood sugar also directly impairs the function of the white blood cells that are your first line of defense against infection. So your body's ability to fight the fungus is weakened at the same time that the environment for fungus is being made more hospitable. A study from the American Journal of Medicine found that diabetic patients were significantly more likely to have recurrent fungal infections of the feet and nails. And those infections were harder to treat and far more likely to return. If you've been dealing with athlete's foot or toenail fungus for months or years with limited success, that pattern is worth mentioning to your doctor. It may be less about the fungus and more about what's making your body such a welcoming host for it. I want to ask you one more thing before we get to the final sign. In the comments, tell me, which of these signs surprised you the most? Just write the number. 1 through 8. Which one made you stop and think? I read every single comment, and your answers genuinely shape what I cover next. The 9th sign is the most sobering one on this list, and it's the one I most want you to understand, because by the time it appears, significant time has already passed. Changes in the actual shape of your foot, not just the skin, not just the nerves, the bones, the joints, the structure of the foot itself. Over time, uncontrolled diabetes can physically change the way a foot looks. Here is why. When nerve damage progresses and you begin losing sensation in your feet, you also lose the muscle feedback that keeps the foot's structure properly aligned. The small muscles that hold the toes straight, stabilize the arch, and distribute your weight evenly. They weaken. They stop receiving the signals they need to do their job. And when that happens, the toes can curl inward. Hammer toes develop, bunions worsen, the arch can collapse. Pressure concentrates in places that weren't designed to carry it, creating calluses and sores on parts of the foot that have no business being under that kind of stress. In severe cases, a condition called Charcot foot can develop. A rapid breakdown of the bones and joints caused not by one injury, but by repeated stress on a foot that has lost its ability to feel pain. The person keeps walking, the damage accumulates, and the foot slowly loses its shape. Think of it like this. If there were a cracked beam in your floor and you couldn't see it or feel it, you'd keep walking across it every day, adding weight, adding pressure, never knowing. Eventually, the damage becomes visible, obvious, and by then much harder to repair. That's what happens to a foot that has been walking without proper pain signals for years. A study from the Journal of the American Podiatric Medical Association found that regular foot examinations, both daily self-exams at home and professional exams by a doctor, significantly reduce the risk of severe diabetic foot complications. Not a little. Significantly. Something as simple as looking at your own feet every day, having a doctor examine them at every visit, wearing well-fitted shoes. These are not complicated interventions. They just require that someone tell you they matter. Consider yourself told. Now, I want to give you something real to walk away with. Not vague advice, actual steps. First, get your blood sugar checked. If you haven't had a fasting blood glucose test in the past year, call your doctor's office tomorrow and ask for one. It is a simple blood test. It takes a few minutes, and it can tell you everything you need to know about where you stand. If your results come back in the pre-diabetes range, please do not treat that as "you're fine." Treat it as a warning, with time still on the clock, because that is exactly what it is. Second, examine your feet every single day. Morning or evening, pick a time and stick to it. Take off your socks. Look at the bottoms, between the toes, around the heels. Use a handheld mirror if you need to. If you find a sore, a color change, or anything that doesn't look right, don't wait to see if it resolves. Show it to your doctor. Third, protect your feet. Never walk barefoot, even in your own home. A small cut you cannot feel can become infected faster than you would expect. Check the inside of your shoes before putting them on each morning. Wear comfortable, well-fitted footwear every single day. Fourth, tell your doctor about your symptoms. Every one of them. Don't minimize. Don't say it's probably nothing. Write down what you've been experiencing before your appointment so you don't forget when you're in the room. You deserve to have your concerns heard and investigated. And fifth, take your lifestyle seriously. I know that's a big topic, and I'll dedicate entire videos to it. But I want you to hear one number before we finish. The Diabetes Prevention Program, one of the largest and most important clinical trials ever conducted, found that modest lifestyle changes reduce the risk of developing type 2 diabetes by 58% in people with prediabetes. 58%. Not from a medication, not from a procedure, from walking 30 minutes a day, from reducing refined carbohydrates on the plate, from choosing water over sweetened drinks. These are not impossible things. They are completely doable things, and they can change your future in ways that will matter deeply. I want you to hear something before I let you go. Some of what I've shared today is hard to sit with. I know that. I didn't soften it too much on purpose, because I believe you deserve the truth. But I also want you to hear this just as clearly. Diabetes, caught early, is one of the most manageable conditions in all of medicine. I have patients in their 70s and 80s who have been living with diabetes for 20 years, and they are thriving, active, sharp, living full, joyful, meaningful lives. The difference between a good outcome and a devastating one is almost always the same thing: time. Time to diagnose, time to treat, time to make changes while there is still so much worth protecting. Harold, the man I told you about at the beginning, walks 5 miles a day now. His blood sugar is beautifully controlled. He checks his feet every morning without being asked. And at a recent appointment, he looked at me and said, "Dr. Caldwell, I'm glad you made me take my shoes off." I smiled when he said that, because that's exactly why I do this. You watch this video for a reason. Maybe something has been nagging at you, a feeling in your feet you haven't been able to explain. A sign you noticed months ago and quietly pushed to the back of your mind. A worry you've been carrying without quite knowing how to name it. I want you to know you were right to pay attention. Your body speaks. It sends signals before things go wrong. The question is whether we listen while the message is still gentle, or whether we wait until it becomes impossible to ignore. I'm asking you to listen now. While there is still time, take your shoes off tonight. Look at your feet. Really look. And tomorrow, call your doctor. You have every reason to take care of yourself. The people in your life who love you are one of those reasons. Your own life, the fullness of it, the good things still ahead, is another. You matter. Your health matters, and it is absolutely not too late. If this video helped you, please subscribe to this channel. Every week, I come here to give you honest, clear, practical health information. the kind I wish more people had access to. No confusion, no scare tactics, just the truth, spoken plainly by a doctor who genuinely cares about how you're doing. There is so much more I want to share with you. The signs your heart may be struggling before a crisis arrives. The medications that interact in ways your pharmacy may not have told you. The sleep changes that can predict cognitive decline years in advance. All of it is coming, but only if you're here. So please subscribe. Share this video with someone you love, and leave me a comment. Tell me your name. Tell me how you're doing. Tell me which sign surprised you most. I'm Dr. Caldwell. Thank you for trusting me with your time and your health today. Take good care of those feet, and I will see you in the next one.